Have you ever sat in a doctor's office and wondered what's really going on inside their head? I mean, we trust them with our lives, but how do they take a confusing jumble of symptoms and turn it into a diagnosis? Well, today we're pulling back the curtain on the incredible, high-stakes world of how doctors think. I want to start with just a number, 10 to 15%. Just let that sink in for a second. What in the world could that number represent when we're talking about medicine?
Well, get this. That's the estimated rate that diagnoses are wrong. And we're not talking about some obscure niche field. This is in the ER, in internal medicine, the places we go to most often. It's a pretty sobering statistic, right? And it really shines a light on the incredible pressure and, frankly, the uncertainty that doctors are dealing with every single day.
So the big question here isn't about pointing fingers. It's about understanding. With all the amazing technology we have, how does this still happen? And maybe more importantly, what separates the good doctors from the great ones? How do they cut through that fog of uncertainty and land on the right answer? That's what we're going to figure out. And to do that, we're going to follow a real-world kind of case that shows every single one of these challenges in action. So let's meet our patient. She's 25 years old, and she's just walked into the ER with sudden, sharp chest pain.
Okay, so here's the file. She's young, 25. The pain came on suddenly, it's sharp, and she feels breathless. And then there's this one key detail from her medical history. She's on the contraceptive pill. And right there, boom. The doctor's mind is immediately at a fork in the road. On one side, it could be something totally harmless, like a pulled muscle. But on the other, it could be a pulmonary embolism, a life-threatening blood clot in the lung. The stakes just went from 0 to 100.
So the very first thing the doctor does is start a conversation. But you have to understand, when a doctor is asking you questions, they're not just going down a checklist. It's actually a very sophisticated form of calculation. And the power of just talking is honestly incredible. Check this out. Studies show that a whopping 70 to 90% of correct diagnoses are made based on the patient story alone. Yeah, before any scans, before any blood work, your story is the single most powerful tool a doctor has. And this leads us to a really fundamental idea in medicine. Before they even think about ordering a test, a doctor is forming something called a pre-test probability. It's their initial, educated guess. They're mixing together the details from your story, what they find when they examine you, and their knowledge of how common a disease is for someone like you. So for our patient, a blood clot is really, really rare in a healthy 25-year-old, so that pre-test probability starts out pretty low. Okay, so the suspicion is low, but the doctor orders a blood test just to be safe. But this is where medicine gets really counterintuitive, because medical tests aren't a simple yes or no. There's a ton of surprising math and interpretation that goes into every single result. And sure enough, the first test result comes in. The D-dimer, a test that looks for evidence of blood clots, comes back positive. Now, on the surface, that sounds really bad, right? But a positive result doesn't automatically mean she has a clot. So, what does it actually mean? To get this, we have to talk about two sides of any medical test: sensitivity and specificity. A highly sensitive test, like the D-dimer, is like a giant fishing net. It's designed to catch every single possible fish. The problem is, it also scoops up a lot of junk. Old boots, seaweed, you name it. Those are what we call false positives. That's why a negative result is so powerful. If the net comes up completely empty, you can be pretty sure there are no fish. Now, a highly specific test is more like a spear. It's not going to catch everything, but when it hits something, you can be very, very confident you've got the right target. And this leads to one of the most important ideas in all of medicine, and it's summed up perfectly in this quote. A test result on its own is almost meaningless. Its real power, what it actually tells you, depends entirely on that pre-test probability we were just talking about. Let's try a little puzzle to see this in action. This one actually stumped a bunch of doctors at Harvard Medical School. Ready? There's a rare disease that only affects 1 in 1,000 people. The test for it has a 5% false positive rate. So, you take the test and it comes back positive. What's the actual chance that you have the disease? Go on, take a guess. I bet it's not what you think. So how do we figure this out? Well, let's imagine we test 1,000 people. Since the disease is so rare, only one person in that group actually has it. So that gives us our one true positive. But now, what about the other 999 healthy people? Well, the test's 5% false positive rate means about 50 of them will also test positive, even though they're perfectly fine.
So you've got a pool of 51 positive tests, but only one of them is the real deal. Your chance of actually having the disease isn't 95%, it's about 2%. Just 2. Isn't that wild? It just shows you how much the rarity of a condition can totally flip the meaning of a positive test.
So, we've talked about the math of medicine, but that's only half the battle. Now we have to talk about the psychology, because sometimes the biggest wildcard in a diagnosis isn't in the lab equipment. It's inside the doctor's own brain.
All right, another quick puzzle for you. A bat and a ball cost £1.10 in total. The bat costs exactly £1 more than the ball. How much does the ball cost? I bet your brain just shouted 10p, right? It's okay, most people's does, but that's actually wrong. And the reason our brains make that leap is incredibly revealing.
Psychologists call it dual process theory. We all have two ways of thinking. Type 1 is your gut instinct. It's fast, automatic, it's a pattern recognition machine. It's how an experienced doctor can spot a classic case of the flu from across the room. Then there's type 2 thinking. That's slow, deliberate, and it takes real effort. It's the part of your brain that double-checks the math and realizes the ball actually costs 5p. Now, doctors have to rely on that fast type 1 thinking to be efficient, but it's also where hidden biases can creep in and lead them down the wrong path.
And that's when you get these cognitive biases. Things like anchoring, where a doctor gets stuck on the first thing they hear. Or confirmation bias, where they subconsciously start looking for facts that prove their initial hunch is right. There's the framing effect, where just the way a patient tells their story can change the outcome. And a big one, availability bias, where a doctor overestimates how likely a rare disease is just because they happened to see a case last week.
So with all this going on, the tricky math, the uncertain tests, the biases of the human mind, how do the best doctors make the right call? Well, they do it by weaving everything together, the evidence, the data, and a huge dose of self-awareness. Let's go back to our patient and see how it plays out.
So here's the path our doctor took. First, they took a great history and correctly figured the pretest probability of a clot was low. Then, they got that positive D-dimer, but they knew that test was sensitive, not specific. It didn't confirm the diagnosis, it just meant they couldn't rule it out yet. So, they moved to a crucial strategy called ROSE, rule out worst-case scenario, and they ordered a more powerful, definitive CT scan.
And the scan comes back negative. No clot. Phew. With that absolute worst-case scenario confidently off the table, the doctor can now connect the dots to something else. She mentioned she'd had a cold a few weeks back, and that's the final piece of the puzzle. The diagnosis is viral pleurisy, a painful but ultimately harmless inflammation of the lungs lining caused by that old infection. The patient can finally be reassured and sent home safely.
So what does all of this mean for you, for us as patients? Well, understanding this whole process can make you a much better partner in your own healthcare. It shows you just how powerful your story is, how important it is to ask questions about uncertainty, and why sometimes a doctor orders more tests not to find something bad, but to be absolutely certain that it's not there.
And that leaves us with one final big question to think about. We've got absolutely incredible technology these days, AI, genetic sequencing, things we couldn't have dreamed of. But as all that tech keeps getting better, is the biggest challenge left in medicine really what's happening in the lab? Or is it learning to navigate the brilliant but beautifully fallible human mind?